Joining me now, former Assistant Secretary for Health, the U.S. Department of Health and Human Services, Dr. Brett Giroir. Doc, I can't help but think that sort of this excitement to bring back COVID, pandemic, restrictions, on and on, has a lot more to do with power and politics than it does with a mask is going to save you from getting COVID that is now much like the cold.
Well, it's great to be on with you, and I agree. It's a power play, it's virtue signaling, it's all those sorts of things. Yes, we are seeing not a wave, we're seeing a small ripple. Hospitalizations are up from 7,000 to 8,000. Remember, we were at 150,000, and we're at a far different place because even though the cases are up, deaths are not up. That's because people are immune. They're immune because they've had COVID. They're immune partially because they've gotten the vaccine, and most people have gotten the vaccine and COVID. So we're in a much better place. Couple things. There have been no good studies showing that masking really works, but the predominant of studies say, number one, mask mandates do not work, period, full stop. Number two, as a general public health measure, even the Cochrane review, which is sort of the definitive source of reviews of this, showed that masks really don't work. Now, the one thing that I would say is if you're a high risk, an elderly, chronically ill individual, and you're committed to wearing an N95 and wearing it tightly and doing it all the time, you could probably reduce your risk, in an airport or a flight situation. So on an individual level, sure. But let's put it this way. I'm not wearing a mask when I'm flying this summer. I feel very good about it. I've had 4 vaccines, COVID twice. I feel pretty immune, and I'm going to get a cold.
Yeah. Yeah, what I don't get, and you think you make a great point about there's certain people who are going to wear a mask because of certain situations. In the same way, there are certain people during flu season who take precautions. One study said that the CO2 you get from rebreathing in an N95 mask can damage your health, on and on. What I'm wondering, though, in these sort of broad statements and the hysteria, you lived through it and were there in 2020, but so much power was pulled into the government by COVID and by COVID restrictions and mandates, and it changed way more than just health restrictions. It changed education. It changed how we dealt with government spending. It changed our associations. It had all sorts of things. And I'm wondering if you don't sense that there's a group of people who kind of miss that power and that sense of hysteria.
Well, you're asking for a non-medical opinion, but my opinion is yes. There are people who would like to control, most of our lives. They have no idea of what liberty is, about the consequences of overregulation, like the devastating mental health of our children that you pointed out earlier in the program, like all the missed cancer screenings, like the tremendous loss in education, economic development. These are all consequences that are very, that are absolutely catastrophic. And let me make one other comment. Masking children under 6 years old, I think, is never justified. There is no data to show that it helps, and there's reams of data to show that can have adverse effects on all types of learning. And we're one of the only countries in the world, if not the only country in the world, that even thinks about masking children under 6 years of age. In fact, the WHO, often wrong, but the WHO says, don't mask children under 6 and under 12, only in special circumstances. So everybody needs to take a deep breath here, understand where they are. The most important thing is if you are at risk, in other words, you're elderly, you are immunosuppressed, you have cancer, then do those kinds of precautions. And the other thing is make sure you have a plan with your physician, your pharmacist, that if you do get sick, you can get those antiviral medications because they are very, very effective at keeping you out of the hospital. Take a deep breath.
You make such a great point, though, I think, that there's still people pushing things in the name of science that science clearly says doesn't work. And there's a reason for that, as you point out, and there's consequences to it. We got to run, Doc, but it's good to see you. Thank you. Thanks for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to subscribe. Click the red button to get more of NewsNation's fact-driven, unbiased coverage.